Gentlemen, let me ask you something. Your doctor has probably told you to eat more fruit, maybe even handed you a pamphlet. But I want to ask you a more specific question. Do you know which fruit the clinical evidence consistently points to as having the most measurable benefit for male health after 60? Because I can tell you right now, most men I see in my clinic have no idea. And the ones who do think they know, they're usually eating the wrong thing, in the wrong amount, for the wrong reason. I'm Dr. Emily Carter, a board-certified urologist with over 12 years in clinical practice. I've spent a significant portion of that time in exam rooms with men over 60 who are doing their best, taking their vitamins, watching their diet, and still missing one of the most well-documented nutritional interventions available to them. Not because they're not trying, but because the information circulating out there about fruit and men's health is vague, oversimplified, and in some cases, just wrong. Today, I want to give you what the clinical evidence actually says, not what a wellness blog says, not what a supplement company says, what the research shows. Before we go further, drop a comment and tell me what you've heard about fruit and men's health over 60. I genuinely want to know what's making the rounds, because it helps me understand exactly where the misinformation is concentrated. Now, here's what most men have been told. Eat more fruit. It's good for you, full of antioxidants. And that's true, as far as it goes. But that advice is incomplete to the point of being almost useless for men in this age group. Because the question isn't whether fruit is good for you. The question is, what specific compounds in specific fruits are doing measurable things to specific systems in the male body after 60? And when you ask that question with clinical precision, one fruit rises to the top of the evidence base with a consistency that is frankly hard to ignore. Here's what's actually happening in the male body after 60. Testosterone continues its decline, typically falling somewhere between 1 and 2% per year from your late 30s onward. Prostate tissue begins responding differently to hormonal signals. Vascular function, which determines blood flow to every organ, including the heart and the genitourinary system, becomes increasingly dependent on nitric oxide availability. Inflammation, systemic, low-grade, and chronic, becomes a driver of nearly every condition men in this demographic are at risk for. And the gut microbiome, which regulates everything from immune function to hormone metabolism, shifts in ways that amplify all of the above. That is the biological terrain. And it is into that terrain that we need to ask, what does the evidence say? The answer, consistently and across multiple independent research bodies, is pomegranate. I want to be precise here because this is where a lot of popular health content gets sloppy. It's not that pomegranate is magic. It's not a cure for anything. What it is, and what the research shows with unusual clarity, is a fruit that contains a specific set of bioactive compounds that interact with the precise biological pathways most compromised in men over 60. Let me walk you through the mechanism. Pomegranate is extraordinarily rich in punicalagins and ellagic acid, polyphenols found in very few other foods at comparable concentrations. Here's what's important. In the gut, punicalagins are converted by gut bacteria into a compound called urolithin A. A 2016 study from the École Polytechnique Fédérale de Lausanne, published in Nature Medicine, followed this conversion process in human subjects and found that urolithin A directly stimulates a process called mitophagy, the cellular recycling of damaged mitochondria. In plain English, this means the compound helps your cells clean house at the most fundamental energy production level. The study involved both human participants and animal models, and the findings were significant enough that they launched an entirely new area of research into pomegranate's role in cellular aging. Now, here's what's wrong with the way this gets reported in popular health media. Articles will tell you pomegranate boosts energy or fights aging. That framing is so vague as to be meaningless. What the research actually shows is a specific mechanism. Urolithin A upregulates mitophagy, which improves mitochondrial quality, which has downstream effects on muscle function, inflammation regulation, and metabolic efficiency. That's a very different claim than fights aging, and it's a claim that has a mechanistic basis in the evidence. But urolithin A is only part of the story. A 2012 randomized controlled trial conducted at Queen Margaret University in Edinburgh followed 60 male participants aged 45 and older over a period of 4 weeks. Half received daily pomegranate extract, half received a placebo. At the end of the trial, researchers measured salivary testosterone levels and found a statistically significant increase, averaging around 24%, in the pomegranate group compared to controls. They also found reductions in blood pressure and improvements in mood scores. I want to be careful here because a 4-week trial with 60 subjects is not the final word on testosterone and pomegranate, but it is consistent with the proposed mechanism that pomegranate's antioxidant load reduces oxidative stress in the Leydig cells of the testes, which are the primary site of testosterone production. Oxidative stress is known to impair Leydig cell function. Reducing it has a plausible pathway to supporting hormonal output. The mechanism is straightforward. The evidence is preliminary but consistent. Then there is the vascular evidence, and this is where I spend a lot of time with my patients, because vascular health is central to virtually everything men over 60 are concerned about. A study from the University of California, Los Angeles, published in the American Journal of Cardiology, followed 45 patients with coronary heart disease over 3 years. Those consuming daily pomegranate juice showed a 30% reduction in carotid intima media thickness, a direct measure of arterial plaque progression, compared to the placebo group. The control group, by contrast, showed a 9% increase in carotid thickness over the same period. These are not trivial numbers. Carotid intima media thickness is one of the most reliable surrogate markers we have for cardiovascular risk, and critically, for the vascular health that underpins erectile and urological function. Reduced arterial stiffness means improved nitric oxide bioavailability, and nitric oxide is the primary vasodilator governing blood flow, including to the pelvic organs. I want to pause on that point for a moment because it's important and it tends to get lost in the polite framing of mainstream health content. One of the most common complaints I hear from men over 60 in my clinic is reduced erectile quality. And the most common cause, not stress, not low testosterone, not psychological factors, though all of those can play a role, is vascular insufficiency, reduced blood flow. And reduced blood flow is directly tied to endothelial dysfunction and nitric oxide depletion. So when a study shows that a dietary intervention meaningfully reduces arterial plaque progression and improves vascular function, that is not just a heart health story. That is a story about every system in the male body that depends on blood flow. The clinical evidence shows this. Most of what men read online does not connect these dots clearly enough. Now let's address the prostate question, because I know it's on your mind. There is a meaningful body of research examining pomegranate extract and prostate-specific antigen, PSA, dynamics. A study from UCLA's Johnson Comprehensive Cancer Center, published in the proceedings of a major urological conference and subsequently in Clinical Cancer Research, followed 46 men who had undergone surgery or radiation for prostate cancer and were showing rising PSA levels. These men received 8 ounces of pomegranate juice daily. The median PSA doubling time, the speed at which PSA was rising, lengthened from 15 months at baseline to 54 months during pomegranate consumption. That is a statistically significant slowdown. The proposed mechanism involves pomegranate's inhibition of NF-kappa B, an inflammatory signaling pathway that promotes prostate cell proliferation. I want to be very clear about what this means and what it does not mean. This is not evidence that pomegranate treats or prevents prostate cancer. It is evidence that specific compounds in pomegranate interact with inflammatory pathways relevant to prostate tissue behavior. It is a signal worth taking seriously. It is also a finding that your urologist should know about if you are being monitored for prostate health. Let me now give you the action plan, because this is where practical clarity matters. First, eat the whole fruit when possible. The clinical evidence on pomegranate is strongest when consuming the arils, the seeds and surrounding juice sacs, rather than juice alone. Processing degrades punicalagin concentration. If you are consuming juice, Choose varieties with no added sugar and confirm that it is made from the whole fruit, not concentrate. 4 to 8 ounces daily is the amount used in most clinical trials showing positive outcomes. Second, understand that the urolithin A conversion from pomegranate polyphenols is not universal. Research from the Nestle Institute of Health Sciences suggests that only about 1/3 to 1/2 of individuals have the gut microbiome composition necessary to efficiently convert punicollagens into urolithin A. This means the vascular and antioxidant benefits of pomegranate are more universally accessible than the mitochondrial benefits, which depend on your individual gut flora. This is not a reason to avoid pomegranate. It is a reason to also invest in gut microbiome health through diverse fiber intake and fermented foods. Third, timing does not appear to matter significantly based on current evidence. There is no strong clinical signal that pomegranate consumed with meals behaves differently from pomegranate consumed alone. Consistency matters more than timing. The studies showing vascular benefit use daily consumption over weeks and months, not intermittent use. Fourth, if you are on warfarin or any anticoagulant, speak with your physician before significantly increasing pomegranate intake. Pomegranate has demonstrated interaction with cytochrome P450 enzymes involved in drug metabolism, the same pathway affected by grapefruit. This is not a reason to avoid it categorically, but it is a reason to have a conversation with the clinician managing your anticoagulation. Now I want to address the emotional reality underneath this conversation. A lot of men over 60 come to me after years of trying to do the right thing nutritionally and feeling like they've failed, or like the information keeps changing, or like nobody is giving them a straight answer. Here's what I want you to hear. You haven't been failing. You've been working with incomplete information. The advice to eat more fruit is not wrong. It's just imprecise. Now you have the specific mechanism. Now you know which fruit, why it works, and what the clinical evidence actually shows about how it interacts with the systems that matter most in the male body after 60. That's a different starting point. Tell me in the comments, what did you believe about fruit and men's health before watching this video, and what has shifted? I read these comments and your answers genuinely shape what I cover next. I'm Dr. Emily Carter. The clinical evidence on pomegranate is not a wellness trend. It is a convergence of vascular, hormonal, cellular, and anti-inflammatory data pointing consistently toward one of the most accessible dietary interventions available to men over 60, and it deserves to be taken seriously. Take care of yourself, and I'll see you in the next one.